This is 21.3 age. Individuals starting to live longer, so more medication is needed, which comes through the NHS money, and which is through our tax, and more care homes are needed, so money from the family. This could say that they're dependent on their family at older age. Stereotypically, an older individual is seen as not being able to walk, they rely on everyone and need constant attention. In some cases this is true, however very little older individuals fall into this stereotype. Some can raise the question of is being immobile living, so people start to become slower and in turn stop walking and doing activities that they enjoy. So this is questioned as being how bad this is, so if you're not able to walk around, is that actually living? Linking to individuals living longer, more medication is needed for individuals. The typical ages used to be around 50 to 60, but nowadays it's risen about 80 to 85 years. So this means that more medication is being needed by hospitals to help the elderly patients. Also, quality of life is better than it used to be, so this is due to a development in technology. This triangle down the bottom right illustrates how everything influences each other. So biological, this means that are they able to move around, be active, and if they are, then can they meet up with friends and play sport together? However, if they aren't active or mobile, then they lose out on the social aspect. So if they miss out on the social side, they also miss out on the opportunity. For example, playing bowls with a group of friends. Looking at opportunities, there are more sports out there that cater for the younger generation, whereas very little cater for the older generation. So, for example, hockey. There are two different types of aging. The first one is chronological aging, so this is somebody's real age as opposed to the age suggested by his or her mental, physical ability. So there is no way to slow it down. The other type of aging is biological aging. This is the changes in physiological structures and functionings of all the individual's body. When individuals age, they have less efficient cardiovascular system, slower reaction times, a weakened skeleton, and their muscle strength decreases. So the NHS headlines read that elderly care shortage costs the NHS 669 million as a toll of bed blocking crisis spirals, and also Age UK study estimates NHS loss of £2.4 million bed days because frail patients could not be discharged because of shortage of support. But the effects of age and exercise, so people who exercise more are more likely to be healthier and more active for longer, whereas if they didn't exercise, then their systems will give up quicker. The first system I'm going to talk about is muscular and neuromuscular system. So muscles lose size and strength as we get older, which can contribute to fatigue, weakness, and also reduce tolerance to exercise. This is caused by a number of working factors. So, for example, muscle fibers reduce in number of size and shrink. Muscle tissues are replaced more slowly, and lost muscle tissues are replaced with tough fibrous tissues. Changes in the nervous system cause muscles to have reduced tone and ability to contract. A loss of muscle is a process that starts around the age of about 30 and progresses throughout life. In the process, the amount of muscle tissue and the number and size of muscle fibers gradually decrease. So the result of muscle loss is a gradual loss of muscle mass and muscle strength. This mild loss of muscle strength places increased stress on certain joints, such as the knees, and may pose a person to arthritis or falling over. A recent study conducted showed that the total muscle mass decreased by nearly 50% for a person between the ages of 20 and 90. On average, people lose about 30% of their strength between the ages of 50 and 70, and another 30% of what's left per decade after that. So generally, people lose about 1% of their lean muscle mass per year after the age of 40. Nervous disease affecting muscles, including polio. The speed of transmission of impulses from the brain to the muscles also slows down, so it takes longer to get the signal. So this will cause decrease in coordination, balance, fine motor skills, as well as an increase in motor response time and altered proprioception. They're all age-related changes in the neuromuscular system. Regular exercise seems to slow down the rate and decline from many of these pathways. So, for example, muscle atrophy, this could be in gymnastics. So you need muscle to hold yourself up by doing handstands, um, all sorts of front somersaults. But when you get older, as you lose that muscle mass, it's going to be harder. The next system I'm going to talk about is flexibility and how this affects when you get older. So the greatest flexibility occurs around 7 to 15 years old, so in the younger years of an individual. As they age, cross-linkages between collagen fibers increase. Lost water and increased calcium salts deposits, so this increases muscle stiffness. So this affects your flexibility. As you can see from the sit and reach values, the typical are between 5 and 12 years, that's the peak. But when you get down to 40 plus years, the average is around 15. Muscle sheaths become thicker, so again this creates stiffer muscles and tendons, so once again flexibility isn't as good. And also as you get older you lose heat more quickly, so this reduces the permeability of the muscles, so this could take you longer to warm up. Once again this can relate to gymnastics, so if you're not as flexible, for example looking back at the sit and reach tests, the age range for gymnastics is going to be 5 to 12 years, but you barely ever see anyone competing in gymnastics when they're from 25 plus. It's very rare to see someone compete. Next system I'm going to talk about is the skeletal system. So looking at the changes in the skeleton. So bone mass, which is the amount of bone tissue in the skeleton, continues to grow until about the age of 30. After the age of 30, our bones gradually deteriorate. So the first few years after menopause, bone loss is especially rapid. Bone density decreases and bones become thinner and more fragile. And this means they become more brittle, which means a break is more likely in older age. So this is why you don't see many older individuals playing contact sports such as rugby. Bones are living tissue that changes constantly. Old bone tissue dies and it's replaced with new bone tissue. The human skeleton grows and strengthens till about the age of 18 in women and about 21 in men. So bone mass, which is the amount of bone tissue in the skeleton, continues to grow until about the age of 30. After the age of 30, our bones gradually deteriorate, so there's a rapid loss. Bones start to lose more calcium and other minerals. Posture can become progressively hunched as the spinal vertebrae and the discs between them become thinner and compressed due to the loss of minerals and moisture. Joints may become inflamed and less flexible as fluid in joints decreases and the cartilage erodes away from the joints. So you see a lot of older people with hip and knee that aren't as good and they need to be replaced. This is especially common, like I said, in the hip and knee. Joints become stiff due to mineral deposits. So this is bone calcification, and that's very common in the shoulder. Movement starts to slow down and may become limited and unstable. So this is the risk of injuries as they're unstable. Osteoporosis and osteopenia are both conditions that cause low bone density. But with osteoporosis, bones are more fragile with a higher risk of a fracture. So arthritis and other chronic joint problems are at very high risk. This can cause pain, stiffness and swelling to the joint. So for example, horse riding, this is usually done about the age of 30, but after that when they start falling they will start breaking bones more easily and quicker, and it's harder for them to get back onto the horse. So you don't see many racers from the age of 40 onwards. The next system is respiratory system and age. So as we age, our gas exchange is affected. So this means less oxygen to the muscles, which means they're not able to work for as hard as for long. Reduced lung volume, less air can get in and out. So this is, for example, in aerobic exercise, like just going for a gentle jog, an individual can start to feel faint because they're not getting enough air in. Decreased elasticity, so this means the lungs will have less recoil. So this means that less air is able to be forced in and out, and also tidal volumes affected. As a patient ages, there's a gradual change to lung volumes and capacities, so residual increases slightly over time also. This relates to loss of elastic recoil and the reduction of strength of expiratory muscles. This may contribute, although note that expiration is a passive process normally. Ventilation will start to occur, but only in the alveoli in the upper part of the lung. And if the poorly ventilated alveoli don't have a reduction in blood flow to them, then they will increase in shunt and reduction to atrial oxygen tension. So variable responses to currently available drugs to treat pulmonary diseases in older adults. This is getting hold of the medicine if they have a lung disease or anything like that. It's difficult to get hold of the medicine. Respiratory system can really affect an individual's aerobic capacity. So aerobic exercises like running, long distance running, cycling, anything that has long duration. This could be submaximally, but individuals start to find it harder as they begin to age if they don't carry on training. The next system I'm going to talk about is thermoregulation and age. So moderate temperatures, there's no deterioration with age. So with age, heat tolerance assists acclimatization, but during vigorous exercise, there's a delay in the sweating mechanism, so this could be difficult getting the heat out. A study looking at age-dependent changes in temperature regulation, which was done in 2011, said that we recognise that the body temperature of older men and women is lower than that of younger people, and their tolerance of thermal extremes is more limited. So some thermoregulatory mechanisms are voluntary and others are involuntary. So putting a sweater on or seeking the shade are examples of voluntary mechanisms. Shivering and peripheral vasodilation are examples of involuntary. So the hypothalamus is in the control center for thermoregulation. It receives input from thermal receptors throughout the body. Stimulation of the anterior hypothalamus yields vasodilation and sweating. So stimulation of the posterior hypothalamus causes shivering. Elderly people are at a high risk of developing potentially life-threatening disturbances of temperature regulation due to normal age-related changes. For example, it takes an elderly person nearly twice the time it takes a younger person to return to the normal core body temperature, so after exposure to temperature extremes. So this could really affect marathon runners that run in hot countries, as they'll be unable to control their body temperature and get it back down to normal. So this could cause the enzymes in the body to start denaturing, which means that the active site will change and the substrates can no longer fit in, which means there's no more enzyme substrate complexes being made. This is because the kinetic energy is too high, and then vibration causes hydrogen bonds to break. Therefore, the active site changes shape.